any of the lectures I've taken, we can bring up, I suppose you would have been reading now, and you would have many questions. Okay? So this is a very short lecture on implementation and evaluation of health programs. Under this nutrition course, I just want to bring this issue of health programs to your consciousness, because many times health programs are related to nutrition intervention. Because when you look at the people that are the most vulnerable people, the pregnant women, the lactating women, and children, many of the issues that pertain to them are related to nutrition. So that means health promotion to be very important to nutrition. So when we say what is a health promotion program, what comes to your mind? Anybody? Would you like to say what comes to your mind?
I'm trying to make people have more detailed knowledge about their health, things they can do to achieve optimum health, and things that they should, avoid to make sure they are always in a good state of health. Generally, creating awareness, sort of, for people to be more aware and make informed decisions based on the knowledge they have, ma.
Thank you, Mrs. Right. So,
yes, ma'am.
Summarize what you have said. It means that all the activities that are channeled towards prevention of health challenges and education, health education, those are the ones that we're referring to as health promotion program. And the aim is to empower people to be able to take positive steps towards better health by themselves. So this is an approach to improving health. There are other approaches like early treatment and other parts of levels of prevention. But the focus of this lecture is, after designing a health promotion program, how do you implement and evaluate? That's the focus. So I'm aware that Dr. Adejimi has taken you a lecture, right, on designing health promotion program. Can anybody confirm that?
Not yet, ma.
But
she gave us the lecture slides.
You shaded it that you have already taken the lecture.
Oh, there are 2 lectures. There's the last one that she needed to take us on health promotion program. The last one. She shared the slides. She shared the document with us. It's a document. But she's yet to go through with us.
What about food security?
Because she has
she taken the lecture on food security?
Yes, she has, ma.
So that means health promotion is the only one outstanding?
Yes, ma.
What about Dr. Oluwole?
She has taken her lectures, all her lectures.
On health promotion?
Technique, yes, ma.
Okay, so I just want to be sure that you have the background before I go on. So you know health promotion techniques, and you have a document that talks about the designing of health promotion. So today, I'll just take you through the implementation. This lecture is not limited to nutrition, but I'm just bringing it up like a revision. I suppose it should have been taught in other parts of public health, but because nutrition programs are very core, I just want to bring them to your notice. So this is an approach to improving health and well-being that focuses more on prevention and health education. And it's very important because it contributes to overall well-being. When people are able to know what to do by themselves and make positive, take positive steps in that direction, the overall well-being is improved. So the interventions that are instituted as health promotion program are very important, very crucial, and the way they are delivered is also important. So one of the things that is very crucial about the way the health promotion programs are delivered to the population is cultural competence. That means you and I, who are the leaders of the programs or the coordinators, should be able to put other people through such that the programs are delivered with the culture of the people in mind. People should not go against the culture of the population they are trying to serve. So when you bear their culture in mind and you try to adapt to it, it makes the message to be more acceptable. So in this lecture, we're also talking about monitoring and evaluation because they are important for improvement of the health program. So if you institute a health program, I mean implementing a health program from the beginning, before you start the implementation, it's important that you have a baseline figure or statistics about the issues of concern in that population, so that when as you are going through the program can be monitored, and then the coordinators of the program can be checking whether the objectives are being achieved. Then at the end, it will be evaluated to check if the goal is actually achieved. So you see that this is not limited to nutrition, but we want to remind you in this course so that you can now imagine nutrition programs and be able to fit them into the lecture. So there are 3 overarching strategies that are used for intervention. The first one is community-focused strategies. That means when we are delivering intervention or health promotion to the people, we must engage community members and organizations. If you don't engage them and they don't see your program as their own, it will be difficult for them to buy into the program and to follow what they are told to do. It's very important to also note culturally focused strategies. So intervention should be tailored to cultural context. So if there's a particular community where they don't eat pig, for example, and you want to promote consumption of protein, adequate consumption of protein, you will not be giving examples of pig, pork as the kind of meat they should eat in that community. If it's a community where they don't allow women to educate people or lead people, so maybe you need to include more men in your group. So this is just telling us that when you are forming strategies, you are putting up a program, you want to implement a program, in determining your resources, determining the pattern, one has to bear the culture of the people in mind. The language is also important. So if everybody in the community speaks Yoruba, you need to get interpreters if you cannot speak Yoruba. So if you want your implementation to be successful, let's say there's a particular nutrition program, maybe vitamin A supplement. Let's assume that is the health promotion program. You notice that in the community, the children don't take enough vitamin A. And now you have been trained. You have Master of Public Health you want to institute vitamin A supplements in that community. So there are key strategies that will make your promotion of vitamin A to be successful. The first one is health communication. So you need to communicate with the people. You need to speak with the leaders and communicate your intention. Let them know the advantages of the program. Let them know what they stand to gain. Let them know the short-term advantages, the middle, the long-term advantages. If you make people to understand that inadequate consumption of vitamin A can cause blindness, you may want to embrace it more compared to just telling them that it's important for epithelial function. They don't know what is epithelial function. They can't appreciate that. So communication must be tailored to the level of the people. And the big sister is health education. So when you are facing a particular program, it's good to bear other things that are related in mind and do a proper health education that fits that situation. Policy systems and environmental change are also important strategies. You know that anything that is not on policy agenda, government does not support, that thing is not likely to last, because political will is very important in achieving success in any program. If there's no political will, then that program will not fly. And then for the program to be sustainable, there is a need for systems to be put in place. So if you go to a particular community, just give them vitamin A and leave. What happens in the next 6 months? What happens in the next 10 years? Some other children will still be, we still have vitamin A deficiency. But you can institute a system, maybe a system where for the next 5 years, all the children below age 5 will receive these same supplements every 6 months. That can be a system. And then you can integrate your program into the primary health care system. So in which case, every child that comes to the clinic, maybe every child that is born there, registered there, or comes to the clinic for anything, so such children will be given like, or the health staff go out once a week. That can be a good system. Once a week doesn't mean that it's the same children, but whatever they can cover once in a week, they notice, they move on to another community, and it's established. Whether you are there or not, if that kind of system is in place, then they can be successful implementation. And then, of course, the environment. Some kind of environments favor certain things, while others would make certain change to be difficult. So whatever environment change is necessary. If you are educating people, maybe your intervention is healthy diets that deals with obesity. You want people to eat healthy and avoid obesity. Then the environment should not be obesogenic. Remember, I had a client that works in a company in the UK. The person just moved to the UK. And in the company, there's always tea, beverage, cake, biscuit available in abundance as much as you can eat in the office. And here was this lady having a tight schedule, very busy and not able to cook. What do you think will happen? That's free obesogenic environment. The person will just be eating junk snacks, drinking beverage. So if let's assume that they are carrying out health promotion in that company where she works. There has to be an environmental team. They need to pack away all their pots of tea and all the biscuits and snacks. Otherwise, the strategy will, the promotion will not succeed. So let's assume that you concluded on the program you want to sell, you want to implement, and now you have decided you are going to implement healthy lifestyle program. That's what we're going to implement in a particular community. So you identify the need. You cannot just go to a community and force it down their throat and say, all of you, you must eat right, you do exercise, no stress. No, you need to get baseline figures from that particular community. And on the surface, it can look like they have that need, maybe based on past data. But on getting there, it's very important to get a baseline survey, what you have in mind to really check their needs. And then sometimes you might perceive a need that may not be the felt need of the people. So implementing the program on perceived need can actually be a program for the conveners. The people might not embrace it. If they feel they need something else. So it's always a very good idea to find out their own felt needs and marry it with your own perceived needs, and then see how all the needs, these so-called needs, align with national goals. So if they align, then that means there's likely to be political will that will make it to work out well. So when you now conclude on your goal that is situated within national goal, and if possible, it's also a felt need. Then you need to define the goals very well, succinctly, and define the objectives and the milestones. What are the timelines? They must be defined. Then explore evidence-based resources related to your goals. So there will be resources in the environment, there will be resources that you might not be aware of on the surface. So you need to explore so that you don't spend the limited funds on what is available and get stranded later. So there are always resources. You need to conduct research by interviewing, surveying, observing, to have baseline statistics that you can compare with and be able to say whether your intervention has any effect, any impact on the people, on the situation at all. Then you need to brainstorm and map out potential risks, engage with your community partners, ask for feedback, draft the intervention plan. Anything that you want to succeed in life, the plan must be clear, obvious, clear, of course, written. And then you need to gain support of the people, the community, the politicians, and other stakeholders for the initiative. So having done all of this, plan is ready, people are ready, resources are identified, then you need to assign and delegate essential tasks to specific people who will be in charge of the task. Anything that is not delegated to specific people may never get done. So if you want to intervene in a community on healthy lifestyle, you want them to change health, or maybe it's healthy weight management, then you need to delegate who is going to give health talk on different days, who is going to be in charge of food demonstration, who is going to take them on exercise. Those things will be delegated and specific time will be allotted. That's what turns your plan to a program. To specific people, specific time, those things will be allotted and clearly stated. Then finalize your plan, allocate resources, and implement it. So I'd like us to look at examples of successful nutrition programs in the past so that you can understand when it is your turn to start one program. Yeah, so this there's a drop relief program that was done in Botswana. This program aimed to address malnutrition during drought. It provided emergency food assistance. Okay, so when this kind of program was being thought of, then they must have put these things they did as the necessary action in their plan. They will provide emergency food assistance, they will provide nutritional supplements, they will give nutrition education, and they did. So you see the three components of their program. The focus was on vulnerable populations. So they focused on pregnant women, lactating mothers, and children. Remember that resources can never go around everyone. So there must always be prioritization. And in public health balance, we prioritize the vulnerable population above others. So if you have more resources and you want to go beyond pregnant women, lactating mothers, and children, the next group to face is the elderly. If you have more resources still, then you move to the adolescents before you think of adults that are in the working age group. This program, because those ones are thought of as people that can sort themselves out. So they are the last people. This program success was attributed to community involvement, timely interventions, and effective targeting of beneficiaries. So you see their own strategies that made their program to succeed. Community involvement, remember we talked about community approach earlier. And then that the intervention came in on time at the time it was needed. And then they also targeted specific people, that's the vulnerable. Another program that is an example of a successful nutrition program is Integrated China Development Services in India. So just to give you an example, they also targeted the vulnerable people, and their services include supplementary nutrition, health checkups, immunization, and basic education. So you see that the component can vary depending on what the focus of that program is. Sometimes it's the donors that determine the focus. The donors will just specify that they want the program to be targeted at adolescents or at preschool children, or they just want people to do routine health check. So whatever is their passion, that's what they want their money to go into. But when program is being designed, the specific services should be clearly stated. So this particular program has improved child health, reduced malnutrition, enhanced childhood development. And the two examples I've just given highlight the importance of community participation, effective targeting, and sustainable approaches. Now let's come to Nigeria. In Nigeria, we've also had a couple of programs that have succeeded. Vitamin A supplementation is one of them, and its aim is to prevent vitamin A deficiency. So supplements are provided for children between 6 and 59 months, and efforts have been made to increase coverage. The challenges persist. So it's succeeding, yeah. Efforts is ongoing. Maternal and newborn health and nutrition is another program. So this one focuses on women and newborn. So the goal is to improve nutrition during pregnancy and early childhood. So pregnant women, then newborn. Who knows the definition of newborn? There are many doctors on the Zoom course. What's the definition of newborn? Are you
Maybe that
drinking?
was just born.
Eh?
Maybe that was just born, ma.
And they define it. You don't talk like that. It's messy. You define it. How many days? How many
I
weeks?
think less than 28 years of age.
Yeah, you are really shiny, oh, pharmacist. You are doing well. You should score the highest mark in this class.
And I'm not gonna have a baby. That's why I just gave birth not long.
You just gave birth.
Not long, ma. Maybe it's
Okay.
4 months now.
Okay. Dr. Folarin,
Yeah,
do
so
you want to
it's
say
from
something?
Yes, ma. So a newborn will be, well, we refer to them as neonates within the first 28 days of life.
Thank you.
That's essentially.
Yeah, so newborn is a child that is 28 days or less, so that you don't think it's referring to 1 year old. So this program was focused on pregnant women and children below 28 days. The program provided essential nutrients to them and emphasized proper feeding practices and micronutrient supplementation. Another program that has been instituted successfully in Nigeria is zinc and low osmolarity oil deficiency. So I'm sure you've been hearing about zinc in the recent times, more than 20, 30 years ago. So this has been introduced along with low osmolarity oil deficiency to manage diarrhea. Zinc is combined with ORS to reduce the severity, duration, and frequency of diarrhea episodes. So when any child has diarrhea now, it's as long as that child presents to the health center or hospital, it's routine. That child will be given zinc gluconate along with ORS, and it's succeeding. Less children are dying from dehydration and undernutrition that's all because of diarrhea. So you have understanding of health program and how it is implemented. Now let's look at evaluation. I believe that in health management, you would have learned about evaluation. So this will just be a revision for you that monitoring and evaluation are ongoing processes. They're not supposed to stop with the first time a program is done. So monitoring ensures that health promotion programs achieve the intended outcomes. Remember, at the beginning, you set goals, you set objectives, you've assigned people and resources. So monitoring is what you do while the program is ongoing. You keep checking to ensure that the program is going on as planned. The objectives are being fulfilled. And then evaluation is at the end. We want to ensure that the program is giving you the intended outcome. So the outcome of evaluation now becomes input in the follow-up program. Usually, program is not something that you don't want to forget about it. It's supposed to be an ongoing thing. So for you to improve on it the next time you're doing it, you need the outcome of evaluation as an input into the follow-up. Evaluating health promotion program is essential for their design and their improvement. So as you keep evaluating, you keep using the result or the outcome to design or to improve on the program. So what will make evaluation effective? Several keys. Make sure you collaborate with relevant stakeholders to ensure their inputs and perspectives are considered. Always remember the community leaders, the policy makers, those who are leaders, those who are whether political or community leaders. Engage the people themselves, the community, members of the community. Engage the health workers, all stakeholders, get their inputs and perspectives. Then assess resources, understand the resources available for the program. So when you assess resources, you would know whether the program was just effective but not efficient. You'll be able to develop, I hope you know the difference between effectiveness and efficiency, so find out. Then develop evaluation questions, clearly define evaluation questions that align with program goals and objectives. Gather, analyze data, collect relevant data to assess program outcomes and impact. Remember that at the beginning, you would have collected baseline data. So the data that you're collecting at the end, you would compare them with the baseline and you'll be able to determine the impact of your program. Then use the result, use the evaluation findings to inform program adjustment and enhance effectiveness. For example, if you notice while assessing resources that double of the intended resources were spent to achieve your goal, even though there is effectiveness, your goal has been achieved, but if double of the resources were used, then that program is not efficient. So imputing the results into the program, into a follow-up program, would necessitate that you focus more attention on the resources. Were they mismanaged? Were they stolen? Were they given to wrong people? You need to find out and ensure that the follow-up program is more efficient. So what do we do with the outcome and the impact? Share intermediate outcomes. Can be patient satisfaction, service access, program retention rates, or maybe the number of percentage of people received what you are distributing, whatever. Just share it, let people be aware. Discuss potential impacts on diseases. So you can, that can be very encouraging to donors, to other stakeholders. If we say, okay, this thing that we have achieved, this weight management program that we have instituted, we discovered that 50% reduced their weight, and in the process, their blood pressure also reduced, their blood sugar reduced. So that means there's less risk of cardiovascular disease and diabetes in the future. The policymakers, they become more interested because you can juxtapose that with the huge amounts, exorbitant amount that have been expended on the diseases mentioned. So they will know the potential impact. You can also discuss the potential impact on mental health outcomes. And whenever you implement a program and evaluate them, definitely in the process of evaluation, there will be some challenges, like baseline data availability. There can be, that's where if the baseline data was not well captured or not captured, that can be a challenge. Attribution and causality. Sometimes you have impact or outcome. You are not quite sure if it's due to your own program or other confounding factors. The short-term versus long-term effect. Sometimes it's tough balancing short-term outcomes where behavior change with long-term impacts and reduce disease incidence. So because some programs will show immediate effects while others will not show immediately. So that's the measurement challenge. You can't say the program is not effective because you are not seeing short-term outcome. The major outcome might be long-term. Selection bias can also be a challenge if the participants do not represent the target population. That would be self-reported data may not be apt, may not be the true picture. The sustainability and maintenance, assessing whether positive changes persist beyond the program's duration is also a challenge. So by and large, rigorous evaluation methods, clear outcome measures, and thoughtful consideration of these issues will enhance the validity of impact assessment. Any question? So like I said, this is not nutrition, it's not core nutrition topic. It's just to bring it to your consciousness. Have you had this type of lecture in other courses in this MPH?
We had something similar in communications and public health last semester.
Okay. So I hope this
It
is
looks like basic research methodology.
Basic research methodology. You did health promotion in research methodology. That's strange. I don't understand.
No, you said whether we heard something similar.
And what did you hear
in
that
our
is similar in research methodology? Okay, maybe issues about bias.
what I mean,
Okay, I
yes,
understand your
bias,
point. Bias, attrition,
yes, causality.
Causality is a bit different. Okay, at least data, I get your point. But majorly it's communication. That's the course where such things should have been taught, or health management. So just revise your notes and make sure you have the understanding so that you are prepared for action. If you might get a job where you are involved in a program, you remember all these things and you become very handy. All right. So questions on nutrition now. Let's go to nutrition.